Another major development we're following this morning, that significant change to Australia's COVID vaccination program, with the Prime Minister last night saying anyone under the age of 40 can now approach their GP and request the AstraZeneca vaccine. Chief Medical Officer Paul Kelly joins us now from Canberra. Good morning to you. Welcome to News Breakfast.
Morning, Lisa.
It is the case, isn't it, just to sort of clarify that introduction, that people have always been able to approach their GP about that vaccine, but there was no indemnity for the GPs. Do you know how many doctors had been not wanting to do it?
You're quite right. There's no the change really last night was the decreasing of the age down below 40. That was really the only change that was announced last night. AstraZeneca has always been available from anyone in terms of the regulation from TGA for anyone over the age of 18, and there's a preference for Pfizer up to the age of 60. But that preference is a preference. It's a discussion for doctors to have with their own patients and to work through their own risk and benefit in relation to that. So in terms of the indemnity issue, that's something that GPs in particular, but others that have been vaccinating as well, have had many discussions with us about their concerns in relation to that, and that's just another surety to them that there's no fault compensation concept, as well as for the patients as part of that conversation.
As part of ATAGI, though, your advice to the Prime Minister still stands that Pfizer is the preferred vaccine for everyone under 60 because of health concerns. You can imagine why people feel a little confused about this. They mightn't have jabs in the arms, but they're suffering from a bit of whiplash from all these decisions and changes.
I don't know about whiplash, but secondly, I'm not actually part of ATAGI. That's an independent group that's appointed by the Minister, independent experts in immunisation. But I do talk to them a lot, and I do know about vaccines. The issue, I think, is that we, as always, we've had to roll with the changes in this virus right through this pandemic and look at what the current information is and use that and ask our medical experts, in this case ATAGI, for their advice. And their advice is on the balance of risk and benefits in the situation in Australia over the past few weeks and months, is that that over 60, AstraZeneca, the benefits outweigh the risk. Under 60, there is that risk of that rare but sometimes very serious clotting disorder. But as the epidemiology changes in Australia, then that is something that for people to have that discussion with their GP. How, if they're not feeling they're feeling they really want to have that immunisation, they recognise the risk and go through that informed consent process, they can do that now. And GPs will be more confident to do it because of the no-fault compensation component.
Can I ask you, now that the decision's finally been made about making it mandatory for aged care workers, a decision that so many people have wondered why it's been so long coming, why is then September or mid-September the date for everyone to have their first vaccine? Why wouldn't it be just immediately? Is that how far behind we are, that it's actually going to take till mid-September even once we make it mandatory?
So the Prime Minister explained that last night at the press conference, that, and I think this is the crucial point, mandating something like vaccination is not a decision to be taken lightly. You need to weigh up all of the issues that are involved to make sure that we have used other ways of getting the vaccine out, making sure the access is clear, make sure there's no barriers to that. We've got to remember that this is a very large workforce that's spread right across the country, including in rural and remote areas. It has a very high proportion of people from culturally and linguistically diverse groups. A large casualisation of the workforce, and so we need to work through a range of logistic issues to make sure that the vaccine is absolutely available, that they can get both doses because of the time lag between the first and second dose, and so all of those have been taken into account. The AHPPC was very clear in its advice to National Cabinet last night, and National Cabinet was very clear in their decision. The point is, if people are working in that sector, they should get vaccinated as quickly as possible. Not to wait until mid-September. That's just when it will become mandatory.
Oh, I know, but Paul Kelly, we've been having so many people messaging in already this morning, and listening to your words saying that there's a lot to be taken into account. We've been going down this path for so long. Are you personally comfortable with where we're at in the vaccination program?
So in terms of aged care, which is our absolutely most vulnerable group in Australia, I'm absolutely comfortable about the rollout through the aged care sector for patients. They're the ones that are vulnerable. This week we will have absolutely completed, the second dose visits to every single aged care facility in the country.
That's
so
for
we
residents.
We will have 100% coverage for residents,
which was supposed to happen months ago.
Yeah, well, let's move forward and start with celebrating this week. Is that we'll have completed that task. The aged care workforce is another layer of protection around that vulnerable group, and we've seen in Melbourne with the recent outbreak, there were a number of aged care facilities that were either affected or potentially affected through primary close contacts. We had 3 residents were sick. None of them died. 2 of them are back at home. I believe the other one's still maybe in hospital but recovering. That's a very different situation to what we found last year, and that is with a variant of interest as it was there, the Kappa variant. So far in Sydney, and we've put in all of the things we learnt last year in terms of protecting our aged care residents, plus the vaccination. We haven't had a single case in an aged care facility despite that growing outbreak in Sydney. So we have done that work. And now we move forward with the extra layer of protection through the workers.
Yeah, Paul Kelly, thank you very much for your time this morning.
You're welcome.